I was diagnosed with HIV in 1986, so I've been living with it for 17 years. When I first found out, of course I was shaken up and was wondering how to deal with this and what it would mean, so I was not at the moment maybe ready for a prevention message, but at no time did a doctor or nurse ever talk to me about how I might protect myself and my partners in the context of sexual behavior while living with HIV, and I wish they had.
As a physician taking care of people with HIV, clearly talking about sex is important, but in fact it can pose a significant barrier for both the patient and the physician, because in our society we're taught not to talk about sex, at least not to talk about it in honest, sometimes scary terms. But in fact, talking with patients around sex can really strengthen the bond, the rapport that exists between a physician and patient. But it's also effective as a way of disseminating really important health information. Patients don't get good information around sex and risks associated with sexual behavior from very many sources. So physicians can play an almost unique role in providing high-quality information that's reliable and that's delivered in a sensitive manner, focused on the individual needs of the patient.
In the past, prevention messages have focused on people who are HIV negative. But if we really want to get a handle on this epidemic, we must concentrate on HIV-infected people as well. Hello. On behalf of the entire team, I'd like to welcome you to our program, Partnership for Health. My name is Dr. Alexandra Levine. I'm an oncologist, a cancer specialist, and I also take care of patients with HIV and AIDS. I've done that since the beginning of the epidemic, 1980, before AIDS even had a name. I've functioned as chairman of the research committee of the Presidential Advisory Council for HIV and AIDS, appointed by President Clinton, and I've kept my commitment in this area since the very beginning for several reasons. First of all, because I just love the patients, and second of all, because I know how important this area is for our society and for the world society as a whole. HIV/AIDS continues to be a national and an international emergency, not just for the people who have the disease and their families and friends, but for all of us. As medical professionals and those working with individuals infected with HIV and AIDS, we really can make a significant difference. With information, with skills, and with evidence-based intervention that we'll learn about today, we can make a tremendous difference in decreasing the numbers of new HIV-infected people in a remarkably short period of time. I ask you to join me in this commitment toward prevention.
Partnership for Health started as a research study funded by the National Institutes of Health. The way the study was designed is that we had 6 clinics across the state of California, all outpatient HIV clinics. And what we did was to interview patients. We interviewed 900 patients at baseline. All of those patients were sexually active. We then implemented the intervention for a 10-month period. And the way the intervention was designed is that we had 2 clinics that were control clinics. 2 clinics did a gain frame intervention, and 2 clinics did what's called a loss frame or consequences frame intervention. This is simply a difference in how persuasive messages are framed in terms of the potential advantages or gains of safer sex or the potential risks of unsafe sex. We interviewed the patients, as I said, at baseline, and then we followed up with them again, about 2/3 of them at follow-up that we were able to locate. What we found is that at follow-up, some of the patients reduced their unsafe behavior. Now, it's important to understand at baseline there was a real difference between people who had 1 partner at baseline and those with 2 or more partners at baseline. For those with 1 partner, about 26% engaged in unprotected anal or vaginal sex, whereas for those with 2 or more partners, it was 51%, so it was twice as much. When we did the follow-up afterwards, what we found is those with 2 or more partners in the loss frame clinic decreased their unprotected anal or vaginal sex by 38%. This was highly significant. It was statistically significant. And that's what the Partnership for Health data showed us, and the program that we're doing is taking that data and using it to implement a program in a broader number of clinics across the country. In fact, prevention for positives is such a national priority that the CDC, HRSA, the NIH, and ITSA have issued a report called Incorporating Prevention into the Medical Care of Persons Living with HIV. This report was published in the Morbidity and Mortality Weekly Report in July of 2003. The core elements of the Partnership for Health are similar to those that are incorporated within that report. The core elements are: Partnership for Health is a prevention program designed for HIV-positive patients in HIV outpatient clinics. The clinic adopts prevention as an essential component of patient care. Training of all clinic staff facilitates integration of this prevention counseling intervention into clinic standard practice. Materials are essential to reinforce the prevention messages delivered by the provider. Partnership for Health builds on the ongoing supportive relationship between the patient and the provider. During routine visits, the provider initiates a 3 to 5 minute discussion with the patient about safer sex that focuses on self-protection, partner protection, and disclosure. The patient and the provider decide on a realistic plan for the patient around safer sex and disclosure. The provider incorporates good communication techniques and uses consequences-framed messages for patients engaged in high-risk sexual behavior. Then the provider checks in with the patient at each subsequent visit, building on their discussions and addressing challenges as they come up. Referrals are provided for needs that require more extensive counseling and services. The prevention message is integrated into clinic visits so that every patient is counseled at every visit. The core elements are the same across clinics. However, the patient population, the patient's needs, and the patient's circumstances may differ.
HIV is devastating the African American population. If you're talking about diseases and incidences, this is like the #1 disease among African Americans 25 to 44.
HIV infection is currently increasingly affecting the Latino community, and that may be due to the fact that the HIV knowledge is low amongst the community. And that's where the providers have to come in and step in and educate the community while they're providing services.
I think the Partnership for Health program is important because it stresses prevention. We only have so many tools in our handbag to try to treat patients. A lot of times we're so focused on treatment and what happens afterwards, we don't think about trying to stop this early at the start. Therefore, our prevention message is very important in terms of medical care. Also, this is a very concise program. It's very short. It's something I can implement in any of my follow-up visits or my initial history and physical visits as well.
I think that you can think about talking about sex with patients as peeling the layers of an onion so that you don't complete the conversation in one visit. You may begin and you may advance the conversation, but it's really a subject that you need to return to repeatedly.
As an infectious disease physician, in terms of thinking about the whole issue of prevention of HIV infection, certainly I have a role. I have a role on a societal level to try and make sure that we have as few new infections as possible. I have a role in terms of being a physician in a public health setting to try and integrate messages about prevention within that setting. And as an individual physician taking care of an individual patient, I have a role in terms of trying to speak with the patient about prevention in terms of their role in prevention.
Many people, I think less so now, but people living with HIV sometimes think, well, I've already got the worst thing that can happen to me, so what's the point of reducing my risk behaviors? But in fact, somebody with HIV, in addition to being at risk for additional infection with HIV, say strains that are resistant to drugs that the individual hasn't even seen before, these same behaviors can put that person at risk for a number of sexually transmitted infections, which can behave differently in the setting of HIV and can also accelerate, potentially, the course of their HIV infection. And finally, can facilitate HIV transmission to others. So the coexistence of HIV and STDs is a bad mix on a number of levels.
Our clinic did participate in the program, and we were happy to see the positive results. I think that it is a program that really should be routinely implemented in clinic settings.
We as healthcare providers know how important all of this is. But now let's hear from some individuals who are themselves living with HIV.
When I was diagnosed, it was quite a few years ago, and my doctor mentioned initially about safer sex, but it was never discussed much after that. And even though I've changed providers several times, I don't think one provider thereafter ever talked about sex.
In my experience and all of the patients that I've talked to and all the support groups that I've gone to, patients want for it to be okay to talk about it with their physician or provider. They may not have a lot to say at any particular session, but over time they would like to be able to talk about these issues because they're not easy to sort out. It's not easy to know what's highest risk or almost high risk versus medium or acceptable risk.
It is important for doctors to talk about safer sex and HIV with women because there is not a lot of information out there for women. For me, when I first found out that I was positive, it was not anyone that I could talk to about it other than lay people. I think that it's very important for my medical provider to be open with me about sex, about HIV, to be blatantly honest, to not, for me, put any lace on it. Don't sugarcoat it. Just make it plain, lay it out there so that I can really understand.
Disclosure is a very difficult thing. I've been having to do it several times this past year, and it's never easy to do. Having some help to do that and maybe some discussion with a provider as to how to do that might make it a lot easier for people to disclose. And because disclosure is extremely important, it has to happen, especially if you're about to enter into an intimate relationship with somebody. And choosing the moment, choosing the words is so incredibly difficult and so incredibly draining. It's an huge emotional risk for the person who has to disclose, and having help with that would be tremendously beneficial.
I've had one provider in particular where I was in a situation where my partner, who was also HIV positive, this has been a number of years ago, but this provider was both of our physician. And she did work with both of us on that, and we had a close rapport, and we could, talk pretty specifically about sex and other things, and it felt good. It felt comfortable. She was also very, she had a great bedside manner, I guess you'd say. She was just very, in my mind, very trustworthy. She was very thorough. I never had any doubt when I went in, to see her that she was completely focused on me and what my issues were. She was a very good communicator. She put me at ease. She used sort of a combination of humor and just remembering details about me and about my life.
The important parts of this intervention involve training and materials. Both of these were developed in conjunction and with the help of healthcare providers and people living with HIV.
I've been involved with this program as a lead trainer since it began, and it's been very rewarding to see it continue to evolve and improve based on feedback from people living with HIV and from HIV providers who are involved in this kind of work across the country. We train everyone at the clinic, providers and staff. The provider giving this message is key, but health educators, social workers, and others can help support the message as well. And it's important that they all be trained. We help train providers and staff to support their patients in setting realistic goals that will work for them. Now that may include limiting their number of sex partners, using condoms, or finding less risky behaviors, or for some not having sex at all. The training is only 4 hours and it's very interactive. We cover the background research, communication skills, slang terminology that patients use, understanding the patient's perspective, theories of behavior change, and we give providers a chance to practice talking about sex in an honest, open, and non-judgmental approach. This is important life-saving information, but talking about sex can be hard, so we use a little humor along the way.
The reason we're doing this game is to get people to start talking about the words around talking about sex. For this game, I want you to answer only "thank you for asking." So if I say, "Hi, Deborah, it's nice to see you. Are you getting your needs for sex and intimacy met?"
Why, thank you for asking.
There you go. That's how she answers it. Okay, so I want you to all get up and go around the room, and I need to ask 3 people. Something about sex.
One of the activities participants find most useful are role plays, using a variety of patient situations that are realistic and give participants a chance to really think through and practice effective ways to respond.
I thought the role plays were the most useful for me because it gave us an opportunity to actually role play how we would actually do it in the clinic versus just seeing someone else do it and being able to get involved and do hands-on activities.
I thought most useful was the terminology, just because I really don't come across a lot of the terminology, and being familiar with the terminology is really important when you're dealing with people that are using it day by day. If you don't know what they're talking about, they shut down.
Training was excellent. The presenters provided me with a lot of information that was actually new to me. It was just an educational experience for myself.
I particularly found useful in the training the very clear steps of the process and needing to finish up with setting some realistic goals for the patients. And I think that will allow the medical providers, myself included, in the clinic to be able to do this brief intervention and then be able to carry it on to subsequent visits with the patients.
What's nice about this program is that in addition to an interactive training, participating sites get a complete package of support materials that have everything needed to conduct this intervention at their facility. The Partnership for Health package includes waiting room and exam room posters in English and Spanish, patient brochures in English and Spanish, supplemental informational flyers on a variety of related topics, also in English and Spanish, comprehensive training manual, video of sample patient-provider interactions, patient chart stickers, and pocket guides, which serve as a counseling reference for providers.
In evaluating the importance of the Partnership for Health program, I think there are a couple of things that are really key. One, it's research-based. It's been shown to be effective. Two, it's brief, so it doesn't take 20 minutes. And three, it's something that virtually every clinician can learn to do. And those aspects of the program really make it, I think, applicable to national HIV prevention efforts.
HIV touches every portion of a person's life, and a provider is a big part of that life. That really locks it in so that the message gets reinforced and reinforced in a very positive way, so that it really does become a partnership, so that a patient can look at his or her provider and say, wow, that person does care about me and cares about the rest of my life, not just whether I'm taking my meds or not. That's huge.
Mm-hmm. I think that it's important because of all the misinformation. Because it closes the gap. I may not trust everything that you say, but if my doctor says it to me, then I must trust him because he is the doctor and he should be well informed. If I cannot trust my doctor, why am I seeing him? If my doctor's not going to open to me, then why am I seeing him?
And patients want to be able to talk to their providers about sex.
Most assuredly.
Because it's such a big part of everyone's life, and it's that piece that's always taboo, and that's how most of us got infected.
As you can see, HIV prevention counseling is very important for people who are living with HIV and their partners and friends as well. Not only is it important, but these messages can easily be incorporated into existing HIV clinics and other settings. The message is critical. We must prevent new infections. If you will work with us in trying to reduce these new infections, I think we can make a major impact on this epidemic. I thank you more than I can say for your commitment already to treating patients with HIV and AIDS. And now I'm going to ask for one more commitment. Will you join us in Partnership for Health so that we may all make prevention a real priority?
For more information about the Partnership for Health program, contact the address on the screen.